Okay.
All right. Hello, everyone. I am Anne Marie, your host on Scrubs Unzipped, Unveiling Healthcare's Hidden Passions. And today I have a very special guest, someone who I've known for years, and we graduated together. So, can you introduce yourself, David?
I am David Chula, and I'm a respiratory therapist, and I went to school with Anna Marie.
So we go way back when we went to school, respiratory school. Can you share some of your favorite memories from our school days and how they influenced your journey in respiratory therapy?
The conferences were really good. I remember going to funny story. So we were at a conference, and it was all the vendors were there. Mask vendors, doctors, respiratory therapists. You get a lot of contacts, and towards the end, they had a what you call it, a party. So they had this big pitcher of what I thought was lemonade, you know. So I had one drink. I'm like, this is pretty good. It was real sweet. It was delicious. So I had another one, and then I had another one,
Oh
then I
my
had
God.
another one, then I had
Oh
another
my,
one.
oh my
Of course,
goodness.
I had another one,
Oh
and
my
I was
God.
feeling kind of good. I'm like, this is really some good lemonade. And before you know it, I'm like, hey, what's up? I didn't realize it was alcohol. I was like, oops. So I kind of I stopped because I don't get drunk, So it's kind of a funny story, but I think just the industry itself, just really wanting to make a difference in people's lives.
Yeah, I definitely remember that party and some of the people that we knew, they definitely got loose. They were
Yeah,
all drinking the lemonade that was not really lemonade.
yeah. So
So I want to ask you, how have you been doing since we last graduated? Like, what have you been up to?
um, oh, by the way, it's still echoing really bad. You might get that on. You may want to turn down a little bit more. Um, anyways, well, I started working at Lake City when I came out of college. That was my first job at HCA Hospital in Lake City. So I was there for 6 months, and I went from there to North Florida Regional Medical Center. So from there, I was there for 6 years. And I went to home care for a year. I did that for a while. That didn't work out as best as I thought it would. Really challenging. The company I was working for wasn't a bad company. It just home care doesn't. I mean, it's just really hard to get the support you need from um, the. We don't have a union, so it's just pay isn't really where it needs to be, and I needed to pay bills. So I left there and I went to the VA, and I was there for about 5 years, going on 6 years. Well, I unfortunately had to retire due to some medical issues.
Oh, sorry to hear that. So, ha- as a retired respiratory therapist, you've been on the front lines of patient care. How did this experience prepare you, if at all, for your own diagnosis?
Well, um, I think being in the healthcare field has actually saved my life because it taught me to push no matter what, because the patient knows his body or her body. They know their body, and they know what's going on in their body, regardless of the education that you have. And I kept telling doctors for 2 years there's something going on, and they kept saying no, there's nothing there. Because I had, but eventually, long story short, I had a GIST tumor, which is a gastrointestinal stromal tumor. And I felt it in the middle of my chest. When I would walk, I felt it going back and forth. I was having black tarry stools, on and off diarrhea, constipation, back and forth. I couldn't eat. I wasn't having an appetite, and the doctors kept saying, "You can't feel that. There's no nerves there, that pain nerves. You can't feel that." I'm like, "There's something there." Um, so they ran a test and they didn't find anything. They ran some blood tests. They didn't find anything, but I kept saying, "Man, there's something there. There's something there. There's something there." And one of the tests, I was laying on the table to get ready for a an endoscopy, and the doctor put me to sleep as I'm talking to him. And when he woke me up, I'm like, "Did you find the tumor?" He goes, "No, there's nothing there. You're just gonna have to live with it." And I'm like, "No, that's garbage. I know there's something there." Well, long story short, he went down with the tube, but he didn't use a longer tube. Apparently there's two different tubes. So that tube only went right here. It's not going all the way down, and he missed it
Mm-hmm.
by centimeters. He missed it. The
Mm.
way they found it was my digestive doctor did an EDG, which I don't remember what it stands for, but it's kind of like a CT, but you drink a bunch of dye, they give you a contrast, and then you're in the CT. You gotta breathe in, hold your breath, and then breathe out. Breathe in, hold your breath, and breathe out. This happens for a half hour, and then they found it.
Wow.
By the time they found it, it was already stage 4.
Wow.
And I've been telling him for 2 years that there's something there. So they went in, they did a biopsy, which was the biggest mistake because when they went in and did a biopsy, it bled and it bled
Mm.
and it bled. And on September 22nd, I was rushed to the hospital, almost died. They had to give me
Mm.
4 units of blood, 3 units prior, 1 unit after, because I was so my blood level was so low. It was like he told me, he said, "If you don't get blood right now, you're gonna have a heart attack. You won't live through the night." Um,
Mm.
so patient knows what he's talking about.
Mm. Yeah, and even having a medical background, you have experience so that you can advocate for yourself when you are sick. So I think that really, really helped you. So what have been, so I would say that is that one of the toughest experience you've faced, like almost dying?
Well, yeah, but I think it was tougher. I used to meet people that just don't listen. I'll give you another example.
Mm-hmm.
I made it to the hospital again for complications with the cancer, and I was laying in bed, and they put me on a liquid diet, and they gave me some Ensure, and they gave me some soup, and they gave me a popsicle, and all this blah blah blah. So I ate everything. So one of the techs come in, they do a blood sugar, and I said to her, "Don't do a blood sugar. My blood sugar is going to be high because I just ate. That's
Mm-hmm.
normal for anybody. Anybody who
Mm-hmm.
eats, your blood sugar is going to go up for a bit. A normal person who's not doesn't have diabetes sometime within 15, 20 minutes, they'll come right back down again, be normal, you're fine."
Mm-hmm.
So I told her, I said, "Don't do it." "No, no, we got to test it because it's scheduled." I said, "Okay, fine. Go ahead and test it." They did. And of course, my blood sugar was 175. And she panics. I go, "Don't worry about it. It'll go down in about 20 minutes. Come back and get it tested." Well, the nurse comes in with a big old bag of insulin. I
Oh
said,
my
"What is that?"
gosh.
She goes, "That's insulin." I said, "Why are you giving me insulin? I don't have diabetes. I'm not taking that." "Well, the doctor said, your blood sugar is how you going to take." I said, "You're not giving me that, and I'm not taking it.
Mm-hmm.
Test my blood sugar again. It's going to be normal. I told you. I just ate, and you tested my blood sugar. I asked you not to do that, and you did anyways." So what
Mm-hmm.
did they do? They tested my blood sugar. What was it? 80, which is normal.
Wow.
She would have
Wow.
given me that insulin, I wouldn't be sitting here today talking to you.
Wow.
And but and and there's so many stories like that I have that people just don't listen, or they don't critically think. They just do what they're told. Especially new
Mm-hmm.
nurses, they just go and do what they're told instead of saying, "Wait a minute, time out." I've had
Mm-hmm.
situations as a respiratory therapist where doctor orders ABC medicine, and I listen to his lungs, and I go back to the doctor. I say, "You ordered this medicine. It's going to cause even more wheezing than he has now. He doesn't need this. Do this instead." And the doctor's like, "Okay, no problem." But no, people don't do that no more. They just go, "Oh, this is the medicine. Let me go ahead and do it. I got a whole list of patients." And then you go ahead and give them medicine that's not even good for the patient,
Yeah.
or it might kill the person. In that case with the
Mm-hmm.
insulin, that would have been a centennial event.
Yeah.
I wouldn't be here today if that was the case. Or I would have been in trouble. I would have, when I went to a diabetic coma for a bit, and it just wouldn't have been well. You got to listen to your patient. You got to critically
Yeah.
think. You got to
Mm-hmm.
critically think. If you listen to this and you're new in the healthcare field, it's okay to question your doctor, not arrogantly, but critically think. If you think that's best for your patient, I, I've seen doctors do stuff. I had so many stories. I seen a doctor
Mm.
because the person had atelectasis, held the patient down and was ambu bagging him to open his
Oh
lungs.
wow.
And I'm like, what are
Wow.
you doing? Just give him CPAP. But nope, he said up. He's sitting there ambu bagging him for like 10 or 15 minutes while he's as conscious as I am.
Wow.
I'm like, are you serious? But this kind of stuff
Mm.
happens. And it's okay to say, no, I'm not doing that. I'm not risking my license to do that. I'm sorry. Find somebody else to do that. I'm not doing it. And if you get fired for it, then listen, there's always another job out there.
Mm-hmm.
When you lose your license, you'll never get a job again. You may lose that job, but you go to another job and you'll have a job. You lose your
Mm-hmm.
license, you'll never get a job. You'll be working at Walmart as a greeter.
Yeah. Yeah, that's real talk right there. That's definitely a real talk because sometimes people are like yes man and yes people like do whatever you say, I'll do whatever you say, but you really need to critically think and you really need to because their life is in your hands and we're all a team and sometimes like some part of the team will miss things and it's up to you to catch things. So that is a very good story. And it seems like despite the challenges, you have exuded a resilience and positive spirit. Are there any specific moments or stories with your family that have uplifted you?
Um, family dynamics have been weird right now because my daughter's a teen and she's not feeling her dad right now. Like she doesn't like it. Her dad's not cool.
Oh.
So it's we had a chance to go on different vacations. Like we went to California for a wedding. I was sick the whole time I was there, of course.
Hmm.
We went to Tacoma to see my dad. I was sick part of the time that I was there. We're getting ready to go to Pennsylvania, hopefully soon. Um, I'm on and off sick, so it's been real challenging. Um, I think that what's really challenging for me is not being able to work. Um,
Hmm.
because I sometimes like I've been sick for 3 days. I ate
Hmm.
something. I ate something called Beyond Burger, which they probably call it Beyond Burger because it is beyond whatever you would eat, and I would never eat it again. It's disgusting. If you're a vegetarian, just make yourself a salad. Seriously, don't go get a fake burger. You want a burger, just eat a burger. I mean, just I ate it. I got sick for 3 days. I mean,
Oh
finally,
wow.
I've been sick for 3 days. I just today finally feeling better. But where was I going with this?
You're spending time with family and going and
Yeah,
traveling.
yeah. So spend time with family, travel. That's what we're doing now. I'm now soccer mom, so I take my daughter everywhere. So even if I wanted to work, or if I could work, I'm just with like I gotta go get her in a couple hours. Um, and then I gotta take her to swim practice, and then take her to work, and so it's like it kind of eats my day. Um, I would like to get back to some type of work again if I could, but every day I wake up and it's a crapshoot. Is that I'm
Hmm.
basically useless to an employer right now. I can't stand on my feet like I used to and run and I can't do CPR because I know how to do CPR, but physically I can't do it.
Hmm.
I would kill a person. I won't be able to withstand the amount of time. I mean, I just can't. I would like to, but I can't. It's like
Hmm.
a crippled person trying to run a marathon. He wants to. You can want to all you want, but I just can't.
Hmm. Okay. Well, let's lighten things up a bit. If we were to throw a reunion with our school graduates who we graduated with, and you are in charge of the playlist, which three songs would you absolutely insist be played and why?
Um, I'm old school, so I would probably choose a bunch of songs that no one would know about, like stuff from old school days, like some Chubb Rock and
Okay.
Fresh Prince and like
Okay.
things like that. I think that I don't know, nothing really comes to my mind. I had one I was thinking about when I read the question earlier, and it slips my mind now. But I guess my high school my high school song was "Never Surrender" by Corey Hart. So I think
Oh,
that would be
okay.
kind of a cool song. But then again, do you know who that is?
I definitely don't.
No, you don't. See that's what I'm saying. So I'm old. I'm completely old school. I don't like very little music from today. I like some is okay. I'm like 70s, 80s, 90s, a little bit from the 2000s, but mainly 70s and 80s, man. So
I'll go look him up later. I'll go look him up
look, I
later.
never surrender. He's the same guy that says, "I wear my sunglasses at night." You know what I'm talking about? No, you don't know what.
Maybe,
You weren't
maybe.
even born when that song came out. You probably would even. You probably would. Your
Maybe.
mom and
I
dad
don't
weren't
know.
even married at the time that song came out. It's like 40 years ago. That song is probably about 40 years old.
Oh,
So
wow. Yeah, that's definitely older than me.
yes, yes, much older.
So I don't want to keep you too long. So I want to say, ask you, like, your journey has been incredible and inspiring to so many. For our listeners, particularly those in healthcare, what's one message of hope or resilience you'd want to leave them with?
It's all about the patient. You remember why you got into the healthcare field. You didn't get into it because it's a glorified job. It's not. You're gonna have days it sucks. I mean, it just sucks. Let me just it just sucks. You hate it. I've had stuff thrown at me. I've had been cursed at. I've had people lie. I had patients lie about me, say this stuff, and thank God I had a good boss who knew my character and knew it was a lie. And then the husband came back later and talked to my boss and said, "Hey, my wife has dementia. She know what she was talking about. He didn't do that." I mean, it's all about the patient, man. Remember that,
Mhm.
because and also remember that you never know what's going to happen in your future. Whereas you're going to be on the opposite side of the bed. And you don't want that compassionate nurse. I've had uncompassionate nurses that are absolutely terrible, but I've had nurses that were absolutely wonderful. I've had respiratory therapists that were absolutely wonderful. I had respiratory therapists that were absolutely terrible. And just because you're book smart doesn't make you a compassionate person. You know, yeah, you need to have the smarts. I mean, that's important. Um, but people need compassion. At the end of the day, people need compassion. And you got to remember that. And that person is yelling and screaming, he's sick or she's sick, they don't really want to be there. Sometimes they're against their will because their families are making them go, but they don't want to be there. They want rather be out on fishing on the dock. They don't want that, so they yell at you. You can't take it personal, and it's not right. I'm not saying it's right for them to do that. It's not, but just remember that, put in perspective. How would you feel? You knew you were dying and you were 50.
Mhm. Yeah, that's definitely it hits close to home because me, I do have experience of being the patient myself, and sometimes when your rights are taken away from you and you're just like helpless and you have to depend on other people, it's very different. It's very different and very eye-opening. It's very humbling because most of the time when we are well, we can do whatever we want whenever we want, but when you're a patient, you can't. So I think that is very important to be show compassion and be compassionate and show empathy wherever you are. So thank you so much, Dave, for being a part of Scrubs Unzipped, where we share stories behind the scrubs. And I hope you have a great one. I will close out this podcast, but I want you to stick around and we'll talk afterwards. Okay?